Hi, this is Russ. It's April 15th, 2014. This morning I had a minimally invasive surgery on my lower lumbar area between my L4 and L5. I'm going to read the MRI report for that area first and then kind of explain the symptoms. Uh, there's a mild to moderate degenerative narrowing of the disc and desecration of the nucleus. There's a circumferential annular bulge which is more pronounced posteriorly and to the left. There's compression of the thesal sac and compression upon the transversing left L5 nerve root as it enters the lateral axis. This is further complicated by faucet hypertrophy. There is central and foraminal stenosis. So basically symptoms, at first my left leg just started kind of going numb. It's kind of weird. And then when I sat down, it was always a lot worse. If I'd sit down for, I don't know, more than about 2 or 3 minutes, my left leg would pretty much just go numb. So I spent a lot less time sitting down, or if I did sit down, I kind of sat in a laid back position, like a lazy boy chair type position, which was a little bit more helpful. I had a high amount of, after the numbness kind of went away, the sciatica started, which is a lot of feeling going down my leg of needles, kind of a partial numbness, but a very uncomfortable one. It's not like numbness. It's more like the numbness turned into something a lot more aggravating. Then later on that turns to pain. So it just kind of changes over time. It gets a little bit worse. Tried going to a chiropractor at first. It did help for a while. Unfortunately, it doesn't fix anything. It just kind of manipulates your body to where you can, kind of pop you, move you around a little bit so the nerves can, kind of flow a little bit for a while until, it comes back. And then you're back at the chiropractor. At first, got a chiropractor 2-3 times a week. And then finally goes into a couple times and once a week. And then I moved to, once and then every other week. But unfortunately, when you get to a certain point that you haven't been to the chiropractor, the pain starts coming back and increasing. So you're back over there again trying to get relief. It's been a while now. It did not, obviously didn't fix it. It just, I'm at a point now where it's just getting a lot worse. So, I got an MRI, found out what's going on and scheduled a surgery, minimally invasive L4 to L5 laminectomy and discectomy, if I said that correctly. Basically what they did, and I'm going to show you a pamphlet now of what it is. Let's see. That kind of, let's go back. Okay, so if you look at the pamphlet, you'll see basically a picture of what it looks like when a disc herniates. It kind of pushes back on the main part of the nerve, and then it pushes on the small nerve as it exits, which is basically those are the ones that go down your leg or, across your back, your leg, your feet, top, or different areas depending on where that nerve goes. My herniation was not specific to one spot like that. It was herniated across a broader area, but the area that it was pushing on the nerve is going out the left side, as you can see in that one nerve kind of going out. It was kind of pinching that off and pushing on the big one in the back as well. The one on the left did most of the uncomfortableness and the pain. So what they do is they, it's minimally invasive, so they cut about a 2-inch incision. They go in with that metal tube, and they put a small tube in first, and then they put another tube over it that's a little bit bigger, and they do it several times until they reach a larger size, which kind of opens up the area where they can work. And then they take all the small little tubes out, and then they secure the insert so it won't move around, and then they get to the area that needs to be worked on. As you can see in the picture, they have to take bone away to get to the nerve and get to the disc, which is basically in front of the nerve. So they removed some bone, went inside, removed a part of the disc that was pushing against the nerves in those areas. When they were there, they found out I had I had a bone spur as well. I'm not sure how large it was, but it was also pushing on the nerve as well, so they had to grind that off. So basically, got rid of the bone, got rid of the disc that's pushing on the nerve, and then put everything back together. That was this morning, and right now it is about 6:30, so it's probably been a good 8 hours since the surgery. As soon as I woke up, my leg felt great. No more pain, no more numbness. Just kind of felt like everything just you flicked a switch and everything feels really good. I got really sore around the incision area. The whole lower back hurts or I'd say sore when I get up and sit down. I have to use my arms and try to be very careful. First day at the surgery, they told me just to kind of walk around the house. Don't do long walks or anything like that. So I've just kind of been moving around the house. Once I'm standing up and I'm moving around, actually the soreness is quite minimal. Uh, when I sit down, if I'm pushing on the area that they worked, it is sore. So laying down is actually the most comfortable position for me today. Luckily, I will sleep in my own bed, and I'll probably get a good night's sleep as well. Uh, the post-surgery, I did the anesthesia that they used. Did make my stomach a little bit upset, and I have a little bit of a headache today that has slowly gone away. I still have a little bit, but it's slowly been going away over the course of the day. Um, and it's been I don't like headaches, so I'm kind of looking forward to waking up tomorrow and that being gone. But the surgery was a pretty good success. I plan to go back to work next Monday, so that'll be basically a day less than a week, uh, unless I don't feel up to it. But tomorrow I start my walking program. I will get up and walk. Whatever I'm doing, I'll be up every hour on the hour to walk around, and I will start with slow distance or short distance, and I will work my way up to a longer distance. That's supposed to help work the muscles and get the soreness away. They did cut through the muscle, so that has to heal. But they did using modern technology. In the old days, they used to cut your back open, rip the muscle off your back, and then go in and do what they need to do. And it was a very long healing process. Now they can dilate the muscle, cut a small incision, and go through it. So the healing time is a lot quicker. And I look forward to getting past all that and getting rid of the soreness and getting back to normal life. But everything went really well. I'm really happy with everything that went on, and thank you for watching. If anybody decides they are, thinking about doing this to alleviate pain, for me it worked great, and had a very good outcome. The same with my ACDF dual. It was a success as well, so I'm looking forward to having a pain-free life. Anyway, thanks for watching, and I'll update in a few days.